So, what the heck was going on inside my body? Hey y'all, it's Morgan and welcome to the video. Today I'm going to share my pathology results from my recent hysterectomy and endometriosis excision diagnosis surgery. If you haven't checked them out yet, be sure to check out parts 1, 2, and 3 in this series to see my surgery vlog and my recovery so far. And be sure to subscribe so you don't miss future updates. Also, I want to give a little disclaimer. I'm not a medical professional. I just want to share my pathology results as a patient to help other people out there experiencing similar results or in similar situations. However, my background is in biology, so this stuff isn't completely foreign to me. I'm gonna explain everything to the best of my ability, but if there's anything that is unclear or confusing, be sure to let me know down in the comments and I'll try to clarify in future videos. So what surgery did I have and why? I had a total hysterectomy, and that included taking my cervix out, but I still have both of my ovaries. I had a salpingectomy, which is the removal of the fallopian tubes, and I had endometriosis diagnosis and excision surgery. And all of this was done laparoscopically. I have 3 incisions on my abdomen plus my belly button, and then I have an internal incision or whatever where they took out my cervix and stitched that up. So my reason for having this surgery was because I've been dealing with chronic pain that's been debilitating for a couple years now, and I've had symptoms for probably even longer than that, and those symptoms led me to see an endometriosis specialist. You can check out my video about my chronic pain experience to get a sense of what I was dealing with. Eventually, I think I'll post a video about everything that I was experiencing. Anyways, both my doctor and I suspected that I had endometriosis and possibly adenomyosis, which is like endometriosis but inside the walls of the uterus. Prior to my surgery, I had had a transvaginal ultrasound that came back clear, and that is the only imaging that I had done prior to surgery. Endometriosis and adenomyosis are both very difficult to see on imaging. You might be able to see some signs that they might be there, but also you might get clear imaging for them. So the only way to really diagnose them is to look inside laparoscopically. For endometriosis, they'll be able to see it in your pelvic cavity, but for adenomyosis, they have to remove your uterus to diagnose it. I decided to have a hysterectomy on my first surgery because I know that people with endometriosis tend to have multiple surgeries, and I wanted the best outcome of being pain-free. So if my uterus and adenomyosis was causing part of my pain, I just wanted it to be gone. And to be clear, I have pretty much always known that I did not want biological children. That was not something that was ever in the plan for me, so that was not a difficult decision to have my uterus removed, especially if it was going to make my life livable again. Pretty much the only thing that I wanted prior to surgery was to not be in pain anymore. That was it. Okay, so what samples did they remove and from where? So I already mentioned they removed my uterus, fallopian tubes, and cervix. The doctor also noted that my uterus looked boggy, whatever that means. In her doctor's notes, it said could be consistent with adenomyosis. They also removed what they thought might be stage 1 endometriosis adhesions from several different areas. And so those adhesions were removed from my left pelvic side wall, which I'd been having tightness in my left pelvic region for a while. And also like sometimes like it would almost feel like an obstruction over there. Not all the time, but sometimes. They also removed adhesions from my right perirectal area, my retrocervical area, as well as my right uterosacral ligament. So that's a lot of words. Sorry, there's bugs. So that's a lot of words. What does that mean? So pretty much they removed some from the space between my cervix and my rectum, and there was some around my rectum on my right side. And then the uterosacral ligament, from what I've read, connects the cervix to the base of the spine, and it supports your pelvic organs. So I also had a little bit removed from there. And then those samples were sent off to pathology to be tested for endometriosis. So what were the pathology results? The adhesion samples that they sent off came back negative for endometriosis, although some of them were inflamed, but my uterus came back positive for adenomyosis. Okay, so what do those results mean? Let's first start by talking about the difference between endometriosis and adenomyosis, or shall we say the similarities. Both conditions are caused by the endometrial tissue that normally lines your uterus, and that tissue changes with the menstrual cycle, ultimately being shed during the period. But with endometriosis and adenomyosis, that tissue is displaced. It's growing where it's not supposed to grow. The main difference between endometriosis and adenomyosis is where it grows. Endometriosis grows outside of the uterus, while adenomyosis grows inside the muscular walls of the uterus, which makes it harder to see if you were to just go in laparoscopically because it's inside the organ. But it's still not where it's supposed to be. Both conditions can cause similar symptoms, so you can't really distinguish between them until you've done the pathology and the diagnosis process. And sometimes people have both endometriosis and adenomyosis. There's still a lot of research to be done in these areas, determining like what are the causes, how are they related, and that kind of stuff. But the research is lacking. And that endometrial tissue that is growing where it's not supposed to is still going through those hormonal changes, and it's just kind of wreaking havoc and causing pain and inflammation and all kinds of things that are not supposed to be happening. Adenomyosis is harder to diagnose because you have to remove the uterus to diagnose it. I'll do a video in the future more about why that is. But since you have to have a hysterectomy to have it diagnosed, it's probably underdiagnosed in the general population because most people are not out here having hysterectomies, especially younger people. And it's entirely possible that if I chose not to have a hysterectomy, my adenomyosis would have gone undiagnosed. And then I would have came out of surgery with a negative endometriosis result and probably feeling pretty bad. And although the adhesions were not endometriosis, they were still probably contributing to my overall pain. So how do I feel about the results? The results were honestly a bit shocking at first because I was pretty sure I had endometriosis because of how stiff and how tight I was in some areas, but I suppose that could just be the adhesions in general that were doing that. My doctor also thought I had endometriosis, but the thing is, endometriosis and adenomyosis are so close that you can have one or not the other, you could have both, but the symptoms and stuff you're experiencing could be the same or could be very similar. My doctor thought at least some of the adhesions would have tested positive for endometriosis, but none of them did. And then we thought that adenomyosis might be an additional factor, but I guess it was the main factor in my pain, it seems like. And the thought of just my uterus causing me so much full body pain and just completely disabling me is just wild. What? I don't know. And if I didn't have the doctor that I had that let me choose in a normal person get a hysterectomy on the first go, I might still be in the same amount of pain. I don't know how things would have been if I didn't have my uterus taken out. I'm really relieved though that I do have a diagnosis because I've seen on Reddit people post their experiences and they come out of their laparoscopy and they get the results and they're negative for endometriosis. And they're just well, what do I do next? Sometimes people aren't even aware that adenomyosis could be occurring, and even some people with endometriosis aren't even aware of adenomyosis. And to me, if endometriosis is in the conversation, adenomyosis should also be in the conversation because they're so closely linked. But I could have been just one of those lost, confused people after surgery if I didn't have a hysterectomy. So I had some questions for my doctor. My main concern was, will I develop endometriosis in the future? From what I've read, endometriosis and adenomyosis are pretty common comorbidities, meaning they are commonly present at the same time, or they can be, and she seemed to think that I should not have worries about developing endometriosis later on. I know there's probably not enough research in that specific area to really for sure say whether or not that is something I could develop in the future, but it is something that will be on my radar. So if there's anybody out there that's had adenomyosis and years down the road had endometriosis develop, please let me know down in the comments because I'd be curious to see if those people exist. And then my other question was if the adhesions weren't endometriosis, what were they? And she didn't really have a definitive certain answer, but she said maybe like scar tissue. Yeah, she didn't really know, but the adhesions are not normal. They should not be there, pretty much, because the adhesions are just kind of gluing stuff together. So hopefully now that my uterus is gone, my health will continue to get better and my energy will continue to increase. I'm currently 6 weeks post-op. I would say my energy level is increasing a little bit. I decided to switch things up today and film outside. It's a really nice day and I had the energy to drag my stuff out here, and yeah, so I'm feeling good. But I just wanted to bring y'all out to my backyard and have a little chill chat session and go over these results. If you found this video helpful, please give it a thumbs up so it reaches other people. I know that sharing experiences like this are how I've learned a lot about myself and what my body was going through from other people sharing their experiences, so I hope that my experience can also help other people out there get a better understanding of their situation. Alright, that is all for now. Until next time, go check out my Life with Chronic Pain playlist for some helpful information if you're also dealing with chronic pain or health issues. It's some of my experiences and things that I've learned along the way. But I'll see you soon. Bye, y'all.